Myself, Dr. Jayendra Yadav. I'm a consultant neurologist associated with Fortis Hospital, Vashi, DY Patil Hospital, Nerur, and Advita Neurology Clinic in Nerur. Today, I'm going to talk about stroke. The reason is that 29th October is celebrated as an World Stroke Day. This activity was started in 2006 by World Stroke Association. The reason was to create an awareness among public regarding the stroke and the advances which are going on in stroke treatment. Stroke incidence is increasing day by day, and it has reached to a alarmingly high incidence level in recently few years. In 2010 onward, it has been considered as one of the public health emergency. So knowing stroke and identifying it at its earliest will help us to treat it with the best possible treatment options. Stroke, there are two types of strokes like ischemic stroke and hemorrhagic stroke. Ischemic stroke results because of the formation of blood clots in blood vessels, because of which the blood flow gets obstructed and part of the brain which is supplied by that obstructed occluded blood vessels dies out slowly. And the hemorrhagic stroke, there is a rupture of the blood vessels, and then blood vessels then leaks through that blood vessels into a surrounding brain parenchyma, and that is the reason the blood parenchyma, blood substance get damaged, and then the neurodeficit results. Today's my talk will be mainly concerned about ischemic stroke. So there have been advances in the ischemic stroke treatment. So it is very important to understand whether a person has got a stroke at its earliest. There is something called as a window period. Window period is after the stroke onset within 4.5 hours. If a person has got a stroke, ischemic stroke, that's because of the formation of blood clot in the blood vessels. If that person is identified within first 4.5, we can give a drug which is called as a clot bursting drug. The most commonly used drugs in this class are altiplase and tenecteplase. Among these, the altiplase is most commonly utilized in most of the stroke unit centers. The ischemic stroke has to be identified at its earliest, but most of the times a patient and patient relatives fails to understand whether the person has developed stroke or not, and they will see a doctor very late in the disease onset. So we lose an opportunity to treat these patients with these clot bursting medicines, and hence the best option, best for this patient treatment is lost. How do we understand whether the person has developed a stroke or not? So any sudden onset neurological symptom should be considered as a stroke, particularly in those who have got highest risk of getting a stroke, like elderly people, those who have got stroke in the past, or those who have got hypertension, diabetes, those who have sedentary high lifestyle, obese people, those who have diseases like kidney disease, who are more likely to have atherosclerotic, like clogging of the blood vessels, those who have got heart disease in the past, myocardial infarction in the past. These are the people who are more likely to get stroke. And if in these patients any neurological symptoms, the minor looking or the trivial looking symptoms like tingling in one finger, or even just visual changes, giddiness, slurred speech which is sudden onset, or facial deviation which is sudden onset, these symptoms should be considered as a stroke, and patient should be taken to the hospital where investigation can be done at its earliest without any delay to identify whether it's a ischemic stroke or a hemorrhagic stroke. So it is very important first to anticipate that the symptoms can be of a stroke, and to take him to a hospital, such a hospital where an imaging facility is available and a doctor is, preferably a neurologist, is available to carry on further treatment plan. So whenever we see any patient who is likely to get a stroke, he is taken to the hospital and imaging shows that a person has developed a stroke because of the formation of blood clot in a blood vessel. And if you are going to get him in within 4.5 hours, then this novel drug called a clot busting medicine can be administered to this patient, because after 4.5 giving this medicine will be more harmful than its benefits. The other most common stroke is a hemorrhagic stroke. The more important risk factor for this hemorrhagic stroke is hypertension. So controlling hypertension is very important. At times, patient who has got ischemic stroke but has got this ischemic stroke because of the clot formation in a larger blood vessels of the brain, giving a clot busting medicine may not be helpful to recanalize or re-establish the occluded blood flow. So in these patients, we can go ahead with a treatment modality called as a mechanical thrombectomy. In a simple terminology, what does a mechanical thrombectomy means? We are just taking out the clot which is formed in a blood vessel by passing a catheter through a groin up to the brain, to the point where the blood vessel has got occluded. So these treatments are available in very specialized centers which are called as a stroke ready hospital. So there are very few stroke ready hospitals in Navi Mumbai. So it is very important to know which are all these the nearest possible stroke ready hospital in your area. So when a person gets a stroke, it's very important to take patient to such an institute where a stroke can be managed appropriately within the window period. Then this is about the treatment advances in a stroke. It is also important to prevent the stroke. So prevention of stroke, very important to look after and taking care of one's risk factor. The most important risk factors are diabetes and hypertension, and sedentary lifestyle, certain addiction like smoking, alcohol, and drug abuse. So these are the commonest risk factors for the stroke. So person who has got hypertension, diabetes, very important to follow up with a doctor and control this hypertension and diabetes so that his stroke risk will reduce in his future. Thank you very much.
Stroke is a serious life-threatening condition that occurs when blood supply to a part of the brain is cut off, causing brain injury, disability or death. It is the second leading cause of death worldwide and the third leading cause of disability. 70% of strokes and 87% of both stroke-related deaths and disability occur in low and middle income countries. The common symptoms of stroke can be dropping of face or mouth to one side with inability to smile, inability to lift or hold hands due to weakness, or numbness in the arms and slurred or garbled speech. If you notice these symptoms, seek medical help immediately. There are two important causes of stroke. First is blockage of blood flow due to presence of blood clot and is called ischemic stroke. It is a major cause of stroke, accounting for 85% of the cases. The other type is hemorrhagic stroke, which occurs due to bursting of blood vessel in the brain. Presence of high blood pressure, high cholesterol, atrial fibrillation, that is abnormal or fast heart rate, and diabetes increase the risk of having stroke. Diagnosis of stroke is important as treatment depends on the type of stroke. Diagnosis is done using two types of tests, that is imaging tests and blood flow tests, which are safe and painless. Imaging tests include CT CAT scan, MRI, CTA and MRA, while cerebral angiography used to assess blood flow. Treatment depends on type of stroke and part of the brain affected. Medication is the most preferred method of treatment. Commonly used medicines include those that prevent and dissolve blood clots, reduce blood pressure and reduce cholesterol levels. In some cases, the treatment includes surgical removal of blood clots, closure of ruptured blood vessel for stopping the bleeding. People who survive stroke need rehabilitation to cope up with the problems caused by brain injury. This includes providing help for daily activities and other practical tasks. Adopt a healthy lifestyle to prevent stroke. Healthy eating habits, regular exercise, moderation in alcohol consumption, and avoiding smoking helps reduce chances of stroke. Be aware of stroke to keep it away. Thank you.